STDs and pregnancy and overview. Are you putting your unborn baby at risk without even knowing it? Could that simple itch or discomfort signify something far more dangerous? In this eye-opening video, we uncover the startling realities of sexually transmitted diseases, STDs, during pregnancy. Millions of women worldwide are unknowingly carrying STDs that could have devastating consequences for both them and their unborn babies. Sexually transmitted diseases, or STDs, can pose serious risks during pregnancy, affecting both the mother and the developing baby. STDs are infections passed from one person to another through sexual contact. It is crucial for expectant mothers to be aware of these risks and take necessary precautions. Early detection and treatment are vital to prevent complications and ensure a healthy pregnancy. STDs can lead to various pregnancy complications, including miscarriage, preterm birth, and low birth weight. Some STDs can be transmitted from mother to child during pregnancy, labor, or delivery, leading to serious health issues for the baby. These infections can cause eye infections, pneumonia, or even life-threatening conditions. Fortunately, many STDs are preventable and treatable. Regular prenatal care, including STD testing and counseling, is essential for identifying and managing any potential risks. Pregnant women diagnosed with STDs can receive appropriate treatment to protect their health and the well-being of their babies. It is important to remember that STDs don't always have visible symptoms. Therefore, regular testing is crucial, especially during pregnancy, to ensure early detection and timely intervention. By understanding the risks, seeking proper care, and taking preventive measures, expectant mothers can help ensure a healthier pregnancy and a brighter future for their children. Section 2. The impact of STDs on pregnancy. STDs can have a profound impact on pregnancy, leading to a range of complications for both the mother and the developing baby. These complications can range from mild to severe, even life-threatening in some cases. One significant risk is preterm birth, where the baby is born before 37 weeks of gestation. STDs can trigger inflammation and infections that disrupt the normal course of pregnancy, leading to early labor. Premature babies are at a higher risk of health problems, including breathing difficulties, feeding issues, and developmental delays. Another serious concern is low birth weight, where the baby is born smaller than expected. STDs can interfere with the baby's growth and development in the womb, resulting in low birth weight. These babies may experience health challenges, such as difficulty gaining weight, weakened immune systems, and long-term developmental issues. In some cases, STDs can lead to miscarriage, which is the loss of pregnancy before 20 weeks. Infections can damage the placenta, the organ that provides nutrients and oxygen to the baby, increasing the risk of miscarriage. Furthermore, STDs can cause congenital disabilities, which are birth defects present at birth. Some infections can pass from the mother to the baby through the placenta during pregnancy, affecting the baby's development and leading to physical or intellectual disabilities. Section 3. Common STDs in pregnant women. Several STDs can affect pregnant women, each posing unique risks to both the mother and the baby. Chlamydia and gonorrhea are two common bacterial infections that can cause pelvic inflammatory disease, ectopic pregnancy, and infertility if left untreated. During pregnancy, these infections can lead to preterm labor, premature rupture of membranes, and low birth weight. Syphilis is another bacterial infection that can have severe consequences during pregnancy. Congenital syphilis can occur when the infection passes from the mother to the baby through the placenta. This can result in stillbirth, miscarriage, or serious health problems for the baby, including skeletal abnormalities, blindness, and deafness. HIV, the virus that causes AIDS, can also be transmitted from mother to child during pregnancy, labor, or delivery. HIV weakens the immune system, making it difficult for the body to fight off infections. While there is no cure for HIV, early detection and treatment can significantly reduce the risk of transmission to the baby. Herpes simplex virus, or HSV, is a common viral infection that causes genital herpes. While most babies born to mothers with HSV do not develop problems, neonatal herpes can occur when the baby is exposed to the virus during delivery. Neonatal herpes can lead to serious complications, including brain damage, seizures, and even death. Human papillomavirus, or HPV, is a common sexually transmitted infection that can cause genital warts and cervical cancer. While most HPV infections clear up on their own, some high-risk types can lead to cervical cancer if left untreated. During pregnancy, HPV infection can increase the risk of preterm labor and low birth weight. Section 4. The importance of routine STD screening during pregnancy. Routine STD screening during pregnancy is crucial for protecting the health of both the mother and the developing baby. Many STDs don't always present noticeable symptoms, especially in the early stages. Early detection through screening allows for timely treatment and management, reducing the risk of complications. Screening typically involves blood tests, urine tests, or swabs of affected areas. These tests are safe for both mother and baby and are usually covered by insurance. The timing of STD testing during pregnancy may vary depending on the specific infection and individual risk factors. However, most healthcare providers recommend testing for common STDs, such as chlamydia, gonorrhea, syphilis, and HIV, at the first prenatal visit. Additional testing may be recommended later in pregnancy or during labor if a woman has certain risk factors, such as a new sexual partner or symptoms of an STD. Early detection through routine screening is vital for prompt treatment and prevention of complications. Section 5. Treatment and management of STDs during pregnancy. Treating STDs during pregnancy is essential to prevent complications and ensure the well-being of both the mother and the baby. The specific treatment approach will depend on the type of STD diagnosed. Bacterial STDs, such as chlamydia, gonorrhea, and syphilis, are typically treated with antibiotics. It is crucial to complete the full course of antibiotics as prescribed, even if symptoms improve, to ensure the infection is completely cleared. Viral STDs, such as HIV and herpes simplex virus, or HSV, require different management strategies. Antiviral medications can help suppress the virus and reduce the risk of transmission to the baby. In the case of HSV, suppressive therapy may be recommended during pregnancy to prevent outbreaks and reduce the risk of neonatal herpes. Treatment during pregnancy may involve special considerations to ensure the safety of both the mother and the baby. Healthcare providers carefully select medications that are safe for use during pregnancy and monitor the mother and baby closely for any potential side effects. It is crucial for pregnant women diagnosed with STDs to follow their healthcare providers' recommendations for treatment and follow-up care. Adhering to treatment plans and attending regular prenatal appointments can significantly reduce the risks associated with STDs during pregnancy. Section 6. Preventing STDs during pregnancy. Preventing STDs during pregnancy is crucial for protecting the health of both the mother and the baby. The most effective way to prevent STDs is to practice abstinence or be in a mutually monogamous relationship with an uninfected partner. For individuals who are sexually active, using barrier methods, such as condoms, consistently and correctly can significantly reduce the risk of STD transmission. Condoms create a physical barrier that prevents the exchange of bodily fluids, which is how most STDs are spread. Getting tested for STDs before pregnancy is essential, especially for individuals with multiple partners or a history of STDs. Early detection and treatment can prevent complications during pregnancy. Open communication with sexual partners about STDs and testing is crucial. Encourage your partner to get tested and discuss any concerns or questions you may have with your healthcare provider. Regular prenatal care is essential for maintaining a healthy pregnancy and receiving timely STD testing and counseling. Prenatal visits provide an opportunity for healthcare providers to monitor the pregnancy, address any concerns, and provide guidance on preventing STDs and other infections. Section 7. Postnatal care for mothers and babies affected by STDs. Postnatal care for mothers and babies affected by STDs focuses on monitoring for any potential complications and providing appropriate interventions. Mothers diagnosed with STDs during pregnancy may require follow-up testing to ensure the infection is completely cleared. Babies born to mothers with STDs may also need to be tested and monitored for any signs of infection. The specific testing and monitoring recommendations will depend on the type of STD and the individual circumstances. Breastfeeding recommendations may vary depending on the specific STD. For example, breastfeeding is generally considered safe for mothers with HIV who are receiving antiretroviral therapy. However, mothers with untreated HIV or other STDs may be advised to avoid breastfeeding to prevent transmission to the baby. Postnatal care also involves providing emotional support and counseling to mothers and families affected by STDs. It is essential to address any anxieties or concerns they may have and provide resources for coping and support. Section 8. Emotional support and counseling. Receiving a diagnosis of an STD during pregnancy can be emotionally challenging for women. Fear, anxiety, guilt, and stigma are common emotions that may arise. It is crucial for pregnant women to receive emotional support and counseling to help them cope with these feelings and make informed decisions about their health and the well-being of their babies. Healthcare providers can offer counseling and support, providing accurate information about STDs, treatment options, and the potential risks and benefits of different courses of action. They can also address any concerns or fears and provide reassurance and guidance. Support groups and online resources can also be valuable sources of information and emotional support. Connecting with others who have experienced similar challenges can provide a sense of community and understanding. Remember that STDs are treatable medical conditions. Seeking help and support is a sign of strength and a commitment to the health of both the mother and the baby. Section 9. Protecting the future. Early detection and comprehensive care for STDs during pregnancy. Early detection, comprehensive care, and preventive measures are paramount in protecting the health of both mother and baby when it comes to STDs during pregnancy. By understanding the risks, seeking proper care, and taking preventive measures, expectant mothers can help ensure a healthier pregnancy and a brighter future for their children. Remember that STDs don't always have visible symptoms. Therefore, regular testing is crucial, especially during pregnancy, to ensure early detection and timely intervention. By understanding the risks, seeking proper care, and taking preventive measures, expectant mothers can help ensure a healthier pregnancy and a brighter future for their children. Open communication between healthcare providers and expectant mothers is essential in addressing concerns, providing accurate information, and ensuring appropriate care throughout pregnancy and beyond. By working together, we can strive to eliminate the stigma surrounding STDs and empower women to make informed decisions about their sexual health.